The clinic is a joint venture between Cleveland Clinic and Amwell, and really the problem we're trying to solve is access to care. If you're given a diagnosis, it could be life-threatening, could be complex. You want to make sure that you're really getting the best advice. Virtual second opinions allows us to provide access to people regardless of where they live.
This is the beauty of the virtual visits. I will review a patient's studies, talk to them, and then I will arrange for them to see the best physician for their problem. And that usually or frequently is the best surgeon, the best cardiologist in the United States, if not the world.
Our partnership's unique in the fact that we're bringing the expertise of Cleveland Clinic, 100-year-old institution, first in many, many medical advances. And we're bringing in Amwell, leader in telehealth and leader in digital health technology. And combined, we're able to do things that wouldn't be possible either as a technology company or an academic medical center. So the ultimate test of a second opinion program, are you helping that patient make better decisions? 72% of the time, we recommend a change in the treatment pathway. And a full 28% of the time, there's actually a change in the fundamental or the core diagnosis.
If you have the correct diagnosis and you're on the correct treatment for that diagnosis, then you don't undergo unnecessary tests. You don't undergo unnecessary surgeries, hospitalizations, potentially emergency room visits. It improves your own outcomes, and quite frankly, from a healthcare systems perspective, it lowers the ultimate cost of our healthcare system.
Whether you're a health system, whether you're an employer or a health plan, you're trying to make sure that you're delivering the appropriate care and you're delivering it in a high quality way. And I believe that the virtual second opinion program really helps hit the mark on all of those.
I'd love to see this spread all over the world. I'd love to see all patients who have cardiovascular disease being able to ask us questions and get the best treatment they need.
I went into pediatrics to help children and help their families. And to be able to provide that consultation to them, touch their lives and improve their well-being. This is why I became a pediatrician. This is why we went into healthcare.
Thank you so much, David. It is an absolute pleasure to join you all virtually at the American Well Client Forum. It's appropriate that today's themes kicked off by Roy and Ido is about Converge. And that really is the story of this joint venture, The Clinic by Cleveland Clinic. It is a convergence of two tremendous assets in their own rights. One, a clinical institution, the other, an absolute stalwart in technology and experience. And I'll be explaining how access is no longer something that only a few, the privileged who live in a geographic area, get to experience. How do you actually deploy excellent clinical care at scale? And then lastly is how do you actually create an unbelievable frictionless experience, not just at that moment, but then when that patient falls on for ultimate care. It's an absolute pleasure to talk about the two unions, if you will, between the Cleveland Clinic and American Well. So let's talk about a little bit of these assets and why 1 + 1 is not 2, but indeed 10. You know, at the clinic, we are all salaried. We serve with one utter purpose, which is patients first. We don't get incentivized to do procedures. We don't get incentivized to do surgical back procedures, and we'd be happy to refer that patient to SOAR. That has been our history for 100 years, and it will be for the next 100 years. But patients first and excellence is not just, you know, one laurel. It's about scale and how do we actually bring these unbelievable experts, 3,500 physicians who are experts in their own domain, #2 hospital in the globe, and #1 heart center for over 26 years. How do we actually take this asset and reimagine it through the lens of something else? American Well, obviously, you're all well-versed on the platform, and it's really exciting to hear about Converge, the partnership with Google, Twilio and others to really take this experience that we've all experienced with COVID and virtual health to the next level. And then certainly American Well and their customers, payers, providers, self-insured employers know the experience. Their members care about a frictionless experience that's secure, pleasurable, efficient, and that it works. Next slide. So when we thought about the clinic and what value asset, it broke down into two areas. Our members, those patients who are trying to navigate the complexity of healthcare, ultimately needed an unbiased, unvarnished expert to provide them with optimal protocols, optimal recommendations. Again, I think it's a perfect segue from the conversation we just had with Sword, that sometimes surgery is not the best option, right? We can understand what the best pathway that's evidence-based, that's cost-effective, and ultimately the safest. Our members care about that because they want assurance. They want the importance of trust. They want unbiased truth. And we know that navigating healthcare is really complicated and frankly, sometimes daunting. Health plans want digital experiences that don't just drive up utilization. Technology and assets, and you go online, can drive up utilization and cost, but does it change value? Does it change the quality and ultimately lower healthcare costs? And so we feel like it's absolutely imperative that the clinic is powered by the Cleveland Clinic in terms of the clinical care, coupled with the expertise of technology at scale at a global level to achieve both objectives. Let's hear a little bit about a video, and we'll segue into the video when we talk about better value at lower costs.
Uncertain about a medical diagnosis or treatment plan? Get a virtual second opinion from world-renowned experts at Cleveland Clinic and turn questions and anxiety into answers and peace of mind. You can connect from virtually anywhere and virtually any way. Without travel or red tape, it's quick and easy and 100% confidential. You speak to a nurse care manager who gathers all your information. Then we collect your medical records, scans, lab samples, and more. You're perfectly matched to one of Cleveland Clinic's 3,500 expert physicians and more than 550 advanced subspecialties. Your expert thoroughly reviews your case and provides a detailed report. You also have a live direct chat with your expert, so you can ask questions and learn more. You become more informed about your health and more confident in your care, moving toward better outcomes with greater peace of mind. Virtual Second Opinions by Cleveland Clinic. 3,500 of the world's best medical experts at your fingertips.
So I think the video did a clear job outlining our dedication on experience, our utter focus on true quality that is personalized, that is simple, and ultimately accessibility. I think what's also important to know is that all of this information is not relegated into some mysterious digital keyway, but is actually available then for future care to be rendered and leveraged this tremendous insight. I'd like to transition this now to my colleague and dear friend, Dr. Peter Rasmussen.
Thanks, Will. It's a great introduction to Virtual Second Opinions by Cleveland Clinic. And the important thing to know about obtaining a second opinion for yourself or your loved one is that the anxiety that is frequently created when you're facing a new diagnosis or uncertain in your diagnosis or question of what the right thing for you or your family member is when you're facing a life-threatening illness is that the key portion is to make the process very easy. And that's where we started with in the design of our program. We wanted this to be the equivalent of hitting an easy button when you're facing a difficult time in your life. As you mentioned in the video talked about, everything begins with a visit with one of our nurse care managers who are conveniently located and accessible through the Amwell digital platform that you already have. Our nurse managers are trained to understand what it is that you or your family member are looking for, what questions and concerns you may have about your diagnosis, or local treatment plan, and then to acquire the relevant medical records, imaging studies, and pathology specimens if it's appropriate for review by Cleveland Clinic experts. If there is pathology, say a biopsy sample and a question of a cancer diagnosis, we obtain not only the slides, but also the tissue blocks, so our pathologists who are subspecialty trained can do additional stains to make sure that the diagnosis is fully honed in on and as accurate as possible. If it's relevant, imaging studies from outside locations are reinterpreted by our subspecialty radiologists, and then that packet of information is presented to one of our super specialists at the Cleveland Clinic. You might imagine it would be easy for a department chairman to have their junior faculty members render these opinions or to assign these opinions to house staff, trainees, or fellows to do the work. That's not the case with our second opinions. Our department chairman, our institute chairman recommend that Cleveland Clinic brand is being put out around the world and that these second opinions are in effect ambassadors of the brand and the hospital system around the world. So our most senior physicians and our experts are actually doing these opinions. Given the level of specialty formation that we have at the Cleveland Clinic, we can get very specific for the patient. So let's say you have a mitral valve concern and you're facing a question about whether you should have a percutaneous procedure or a surgical procedure or whether you need mitral valve replacement at all. We will get you to one of our cardiologists or heart surgeons who specializes in not only valve disorders, but mitral valve disorders. And as I mentioned, this will be one of the world's experts who ultimately then deliver that opinion to the patient via video, through the Amwell platform, or by telephone or by written report, whatever it is the best for the patient or the member. Next slide, please. What we found over time is that about a third of the time, 30% of the time, our Cleveland Clinic experts have a difference in opinion on what the local diagnosis is. And about 75% of the time, we offer a modification or suggested changes to the treatment plan that the patient has. Sometimes these things are quite dramatic. As an example, medical therapy or physical therapy in place of a surgical procedure, or perhaps a different chemotherapy regimen for the cancer that the patient is facing. When each of us is facing a complex diagnosis like cancer or perhaps the need for spine surgery, brain surgery, or heart surgery, I think the first question that goes through all of our mind, or we think about when it's our loved one who's facing this diagnosis, is not where is the closest care or where is the cheapest care, it's where is the best care, because we believe that the best care is the highest value care. Next slide, please. We engaged an external research firm to review 3 months worth of patients that came through our program to take a look at what the expected return on investment would be for you if you're a health plan or an employer. In those instances where we had a change in diagnosis or treatment plan, we found that on average, we were saving approximately $13,000 per patient. If you take a look at the distribution of complaints that we would expect to see in a population in a standard employee practice, this is the distribution that we're finding. And you can see that there's a fair amount of need for reinterpretation and second opinions around cancer, cardiac disease, and urologic and neurologic complaints. These are areas that the Cleveland Clinic absolutely excels in. As Will mentioned, we were the #1 hospital in the world for cardiac care for 26 years, #2 in the nation for urologic care, and consistently in the top 5 hospitals for neurologic care in the United States. Next slide, please. We take the member and patient experience very serious at the clinic. As I mentioned, we want to make this a very easy process for your members and your patients. Those patients who have gone through our process have rated our nurse intake process 4.98 out of 5 stars, and our net promoter score in the first quarter of this year is ranging in the mid-60s. 80% of the members have found the program to be very highly valuable after they've completed it. Even those patients who have no change in diagnosis or treatment plan, leave feeling more confident in their diagnosis and their local treatment plan, and that the second opinion process has brought them great peace of mind, knowing that they've talked to a world expert in their specific condition and that the local treatment lines up with what the world expert says, gives those patients significant confidence in approaching their illness moving forward. And in those patients where we have change in diagnosis or change in the treatment plan, you can imagine the impact that it has in someone who is not sure about the quality of care locally and whether their physician in their community is on the right path. And as a payer or an employer, this obviously has significant cost impact for you, but because clearly paying for treatment of the wrong diagnosis or the wrong treatment plan is absolutely money ill spent. Next slide. We look forward to offering second opinions to you and your members through our partnership with Amwell. And as I mentioned, we can easily integrate into your existing Amwell platform and experience so that your members and employees have a consistent digital experience across all areas.